So Barry, what should I do, and what point should I refer?
So I think we mentioned that we should look for BPPV and try and treat that, and I think effectively treated. If the patient has the chronic symptoms, as we discussed, the sensitive to visual motion and motion sensitivity, then the patient will benefit from referral to rehabilitation services. I think it's also important, as we have touched on in other videos, to always look for common things like cardiac dysrhythmias with an ECG and postural hypotension, because those things will allow you to either modify drugs or make appropriate referrals, for example, to cardiology. At that point, however, when you've exhausted your simple screen and you have a patient who still has chronic dizziness, then it would be sensible to refer for specialist services. However, if you would have picked up a large chunk of patients by making diagnosis of BPPV, and by the time the patient has gone to see the rehabilitation services and you have effectively put in place treatment for BPPV or even migraine, you will have allowed the patient to have been in a fit state to have almost immediate rehabilitation, because the active ongoing problem has been treated to a great extent. And then the patient will slot in to the rehab services. So you're not only beginning the treatment earlier in the whole process, but you're making better use of the rehabilitation, because the patient will be able to be rehabilitatable almost in first contact with the rehab services.